The Centers for Disease Control is issuing guidelines for diagnosing and treating concussions in kids. But the guidelines have some local schools saying not so fast. Ashley Edlin explains why.
The CDC has released 19 specific recommendations to treat mild traumatic brain injuries in children. Among those recommendations, pediatric patients do not necessarily need scans to diagnose a mild TBI. Dr. Cecilia Lim Ransom with Rochester General Hospital says she agrees.
People don't need an X-ray or a CAT scan for every concussion, and that's clear in these guidelines. It says, you don't want to expose somebody unless they have emergent signs of a concussion to warrant a CAT scan of the head, because you're unnecessarily exposing them to radiation.
The CDC recommends caregivers look for specific symptoms, then assess the situation.
We're looking for severe headache with persistent vomiting, changes in behavior, mental status that are more severe than you see from a common concussion.
Another recommendation, caregivers in schools should have kids gradually return to non-sports activities after no more than 2 to 3 days of rest. At Victor schools right now, if a student is diagnosed with a concussion, they are not allowed back in the field until they show no symptoms for 24 hours and get checked out by a doctor. They say they'll consider it, but
we at this time are not going to make any changes. We're going to keep with the same process that we have been using.
And they're not alone. Pittsford will also wait on the state education department's recommendation.
Dr. Lim Ransom told us today she feels the only thing missing from the CDC's new guidelines is direction for on-screen time for kids diagnosed with mild traumatic brain injuries. She says she feels that can affect recovery time. Maureen.
All right, Ashley, thank you. For a full list of the CDC guidelines, visit our website at rochesterfirst.com and click on this story.